Dairy sensitivity can lead to acne through several mechanisms, which involve hormonal imbalances, inflammation, gut microbiome disbalance, and insulin dysregulation. In today's video, we will look at each of these components. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. We will first look at the components of acne proper. What is acne? Acne is a multifaceted skin condition, primarily involving the following components. First of all is sebum production. Sebum is natural oil that is produced by sebaceous glands on your skin. If there is not much of sebum, then you will have a dry skin. If there is too much of it, then it will clog your pores and you will have an oily skin. And what happens? What else could happen to these clogged pores? Dead skin cells and excess sebum can block hair follicles, leading to comedones, whiteheads and blackheads. Open comedones are blackheads and closed comedones are whiteheads. The next one is bacterial growth. Cutibacterium acne, formerly it was called Propionibacterium. It's a bacterium that normally lives on the skin, and it can thrive on these clogged pores, causing inflammation. So the next one, you guessed it, is inflammation. The body's immune response to bacteria and clogged pores leads to inflammation, which means swelling, painful lesions, redness, etc. These components interact to create various forms of bacteria, ranging from blackheads to severe cystic acne. So let's look at these factors that contribute to acne. First one is hormonal imbalance. Milk contains several hormones, both naturally occurring and sometimes added, which I will discuss later in this video. All of them can influence our body when consumed. These hormones include estrogens, which are present due to milk being derived from the mammary glands of cows, especially those who were pregnant or are pregnant. Androgens like testosterone and DHT, dihydrotestosterone, progesterone, it's another female hormone, and insulin-like growth factor are also found in milk. Those hormones can interact with body's own hormones, potentially affecting processes such as sebum production in the skin, which can contribute to various conditions, including, of course, acne. So let's start with androgens. Elevated levels of testosterone, and particularly of dihydrotestosterone, which is DHT, have a significant impact on the skin by directly stimulating the sebaceous glands. When DHT levels are high, the sebaceous glands become overactive, leading to the production of excessive sebum. This excess oil or sebum can accumulate and mix with dead skin cells, leading to clogged pores. And as we already discussed, clogged pores create an ideal environment for bacteria to thrive and propagate and lead to more acne. The presence of excessive DHT can thus disrupt the normal balance of sebum, leading to turning protective mechanism into a contributing factor towards the acne. Next one is estrogen. Estrogen in dairy is another factor that contributes to acne, particularly in people who are sensitive to hormonal fluctuations. So this is how it works. Let's start with natural hormones. Dairy products, particularly those from pregnant cows, as we mentioned, contain natural estrogens. Since milk is derived from the mammary glands of cows, especially those who are pregnant or recently were pregnant, it naturally contains higher levels of estrogen and other female hormones. These estrogens can be present in various forms, including estradiol, estrone, and other metabolites of estrogen. When individuals consume dairy, these exogenous, external estrogens can affect their own hormonal balance. Even a small amount of these hormones can have a significant impact, especially in sensitive individuals. This can lead to an imbalance in estrogen and androgen levels, which is a known contributor to acne. In some cases, additional estrogen from dairy can lead to a state known as estrogen dominance, where there's too much estrogen relative to progesterone. This hormonal imbalance can disrupt the normal skin function and promote conditions like acne. Similar to androgen, estrogens can also influence the sebaceous glands. While estrogen generally has a balancing effect on sebum production, Excess of estrogen or imbalance can paradoxically lead to increased sebum production, particularly when coupled with other hormone imbalances, again contributing to clogged pores and acne. So there's a common theme, as you can sense from this. Estrogen can also affect inflammatory pathways in the body, and imbalance in estrogen levels may contribute to an increased inflammatory response, further aggravating acne. The next section is about insulin resistance, and hyperinsulinemia. There are two hormones in this section that we will cover: insulin and insulin-like growth factor 1, which is, we call it IGF-1 for short. Dairy products contain sugar called lactose that we are all familiar with. So consuming dairy increases insulin level even if there is no added sugar. That means that plain milk causes insulin to go up. Insulin can stimulate then acne via three mechanisms. The first one, again, so if I repeat myself, increased sebum production. Insulin promotes the activity of sebaceous glands, leading to increased production of sebum. Then androgen production is the second thing, because high levels of insulin can lead to insulin resistance. Insulin resistance leads to increased androgen production. So as we just learned, androgens such as testosterone and DHT stimulate sebaceous glands. So indirectly, insulin leads to an increase in androgens. The next mechanism is through IGF-1. What is IGF-1? IGF-1 is a hormone that contributes directly to acne by stimulating sebaceous glands. When IGF-1 levels are elevated, as they can be after consuming dairy products, it increases sebum production. The excess sebum can mix with dead skin cells and clog pores, and again, same thing, create environment for acne-causing bacteria. So elevated insulin levels also can stimulate IGF-1, and additionally, IGF-1 in return can also stimulate keratinocytes, leading to increased skin cell turnover, which also clog pores. The combination of these factors promotes further development of acne lesions. Interestingly, that in some cases, excess estrogen can also trigger IGF-1 secretion, leading to acne aggravations through the same mechanism as well. So there's a lot of common themes, as you see. The next mechanism through which dairy can cause or aggravate acne is inflammation. For individuals with dairy sensitivity, the immune system may react to certain proteins in dairy, such as casein and whey. The immune system then produces IgG and sometimes IgA antibodies to these proteins, and we discussed these proteins in our previous video. This immune response can trigger inflammation throughout the body, including the skin. And of course, that would exacerbate acne, and make more redness, swelling, and even could lead to cyst formation. There's also a release of pro-inflammatory cytokines that contribute or mediate that inflammation. The next mechanism is alteration of gut microbiome. Our gut houses trillions of microorganisms such as bacteria and fungi and viruses and parasites. Dairy sensitivity can affect the gut microbiome, leading to gut disbalance, or as we call it, gut dysbiosis. An imbalance in our gut flora can result in increased intestinal permeability that we call leaky gut, and that allows inflammatory compounds to enter our bloodstream, and that in turn triggers inflammation. The skin microbiome is affected by the gut microbiome. So the gut dysbiosis can lead to an increase of this bacteria that we mentioned earlier, Cutibacterium acnes, which is a critical bacteria in acne development. Additionally, estrogen can affect the gut microbiome, leading to dysbiosis after eating high estrogen foods. The last section is about external or exogenous or added hormones in dairy. RPGase is a recombinant bovine growth hormone. It's also known as RBST, recombinant bovine somatotropin. It's a synthetic hormone that's used in milk industry for cows. It's genetically engineered version of the naturally occurring bovine growth hormone. And when administered to dairy cows, it stimulates production of another hormone, which is insulin-like growth hormone, IGF-1, which we just discussed, which plays a huge role in increasing milk production. So there is some data that shows that animal welfare is affected by the usage of that, in addition to some health risks. So my recommendation is to choose milk and dairy that are free of this RBGH hormone. That's almost better. In some cases, you may not know if the dairy is inside of some products, so you may not be aware that's in it. So what is the best way to deal with dairy sensitivity if you have acne? Of course, ideally, the best way is to avoid dairy products as much as possible, to switch to dairy-free alternatives, and that may be difficult. If it's hard, I would just recommend just cutting down on your dairy intake and just tracking your body symptoms, and to see, especially in this case, we're discussing acne, although dairy can affect many other components and body systems, but specifically we're talking about the skin. So skin is easier to track. So cut down your dairy intake and just see what is happening with your skin. Is there a decrease in the symptoms of acne that you're noticing, or is it milder, or do you have less of certain acne lesions such as papules or cysts, or the blackheads or whiteheads? So it would be very interesting to find out. So thank you so much for listening. Until next time, bye-bye.